Good afternoon from Riyadh and the National Heart Forum number 3. This is Mirvat Alasnag. I'm an interventional cardiologist in Jeddah, Saudi Arabia. And with me is the Director General of the National Heart Center, Dr. Adel Tash. Thank you for taking the time to be with us today.
Thank you very much, Dr. Mirvat, for, first of all, inviting me to this podcast. And second, in fact, the major thanks is for you in guiding the scientific committee and producing this very highly valuable scientific content for this conference.
Well, thank you for the opportunity. You know, I always, when I see the projects that the National Heart Center has done, particularly in the last 1 to 2 years, I think it's caught my attention, but caught the attention of everybody else in the kingdom and outside the kingdom. And most certainly, it is visionary leadership. So where do you see the role of the National Heart Center in improving cardiovascular care within the kingdom?
That's a great question. I think, first of all, just going back to your term, visionary leadership. I like that term because before we were doing a lot of good things in Saudi Arabia. Before we had a real clear vision. The vision that gives us that blueprint, the vision that is the beacon, and I think the main word that I can use is always alignment. So aligning with that vision, whatever we do, whatever project we embark on, we have to see if it's aligned with the vision or not. Does it produce? Does it help us? Does it help the healthcare system to produce the effect or the desired outcome of that vision or not? So when we say that in Saudi Arabia we have a vision of a health span and a lifespan, in short. So the lifespan, we want to increase the average life expectancy of the Saudi citizens from where it was in 2016 of 74 years of age to where it should be at 80. And now we're midway, and we in fact are more than midway in that range. So we reached 77.8 now. Every project that we think about, if it helps us achieve that outcome, then it is aligned. If it helps us achieve an outcome that will help us to achieve that outcome, that is also aligned. So it's, I think the visionary leadership is not the vision of a visionary really works on small steps, but knows what are the small steps that can take you to the larger leap. This is one thing. The second thing is, now when we think about projects at the National Heart Center, we always think, first of all, we don't want to go into operations and provision of care. This is something that we want to facilitate, we want to help in, we want to establish systems that facilitate the proper provision of care. We want to establish systems that provide the best educational capabilities or educational activities that will improve the capabilities of our healthcare workers. We want to establish a system where we could produce guidelines and implement those guidelines on a national level, and not implement, but follow up the implementation or regulate the implementation of those guidelines at a national level. The other thing is we really want to work with the 3 different stakeholders of the healthcare system. So the first stakeholder is the community. We always think, what are the projects that I can really affect the community in a bigger way? The second stakeholder is the healthcare practitioners, our colleagues, members of this healthcare society, members of this vibrant healthcare community. We want to upgrade their skills, enhance them, inspire them, and support them in any way we can. The third, and we as clinicians, we don't think about them a lot. but they are very, very, very important, which is our leadership, regulators, policymakers, budget holders. We really need to talk their language, because if we are enthusiastic about our medicine, they don't understand that in the right way. But when we put it into perspective, when we put it into, for example, how many patients are we going to affect? How many lives are we going to save? And be clear about it, because you can't ask for something that you're not very clear about. What is the expected outcome, and what is the expected investment that we have to make? And I think when you put these three stakeholders in in your imagination and or in your thoughts, and start bundling the projects to the community, healthcare workers, policymakers, leadership, and budget holders.
Just connecting the dots, essentially, so the regulators, budget regulators, and patients, and then ultimately the healthcare practitioners. You gave a very elegant presentation earlier today, and you mentioned a heart-safe kingdom. Talk to us a little bit about that, Dr. Tash.
Yeah, the Heart Safe Kingdom was an idea that really now is getting more and more into becoming more of reality, and these are really the initiatives that we have already been working on, but we need to tie them together, make them more coherent in a sense that they fit in that puzzle where we want to paint a more beautiful picture. So they're parts. So we have initiatives on the acute care of cardiac patients. We have initiatives on the digital health, virtual care, artificial intelligence. We have initiatives caring for the population health. But if you put them all together and you bundle them into there are going to be three, but they all fit together in that puzzle, and they're all aligned with the vision. And if you do that, you will definitely create a heart-safe kingdom. And why not give it an inspiring name? Why not give it a name that will resonate with all of us? Because we are a heart-safe kingdom. We have our spiritual safety by the presence of the holy mosques in Mecca and Medina. We have our safety and stability with our government and our leadership in the Kingdom of Saudi Arabia. We are a very stable nation, and we have also our safety in this very strong healthcare system. And from that stems that we want to improve the heart health of the population so we can save as many lives. And saving lives is not doing a primary PCI only. Saving lives could be identifying a high-risk patient and starting him on good primary prevention therapies and preventing the MI that he would have had 10 years later. That's exactly as important, or even more important, than doing a primary PCI.
And I've also noticed that here at the forum this year, you're signing several memoranda of understanding with international societies and bodies. Again, what is the value of that to the National Heart Center, Ministry of Health, and the healthcare in the kingdom overall?
Yep. Well, we believe in Saudi Arabia in general, and in the health sector in Saudi Arabia in particular, that partnerships are of high value for us. And we do want to partner with partners that have that experience on data collection, on registries, on analysis, on projects that were performed in other countries. We want the best benchmarks. We want to learn from other societies, scientific societies. We want to collaborate from them to elevate we both elevate, and at the end of the day, we don't really want to reinvent a wheel. If a wheel has been already invented, if a society has, for example, a registry, and that registry is robust, and that registry could produce data, and the analysis of that data is tested, why would I restart from scratch? We can collaborate with each other. It's all win-win situations. We all progress together, and of course, the powerful spirit of collaboration is something really at the core of all our projects that we do. So we are signing with the American Heart Association. We have a contract with the American College of Cardiology for the NCDR registries, and that was done a few months ago. Now we're signing with the American Heart Association, with Society of Cardiovascular Angiography and Intervention, and with the TCT Cardiovascular Research Foundation.
Very, very impressive developments and progress that's been made by the National Heart Center, and huge congratulations to you and your team for that. And I think there's much to offer on a bilateral level. So these international collaborations, I think the National Heart Center and your team has much to offer as well, particularly that you've made significant progress in the lines of the virtual hospitals, the virtual hospital, digital health, and so on. So we're really excited, and I'm hoping a year from now to have another interview with you and discuss more steps that have been taken with the National Heart Center. Congratulations, and truly impressive.
Oh, thank you very much. You are an integral part of the team, and if we win together. And if you congratulate me, I also congratulate you.
Thank you very much.